or even if you want to be able to go back and relook at it again. So I'm Mary Chappett, and I am the program director for the Family Caregiver Support Programs at the Department of Aging and Disabilities. And those programs include the National Family Caregiver Support Program and the Respite Care Referral Program and our Telephone Reassurance Programs. I welcome you all here tonight. I really wish we could be doing this in person so that it could be much more interactive. I will try to keep checking chats as we go along tonight if you have some questions. And certainly you all have my email and my contact information, I'm sure, and I'll be showing that at the end of the presentation. So any questions that you have, please feel free to email me or give me a call at any time. So what is respite care? And respite care's definition has kind of evolved over time. Basically, respite means to take a break from the daily challenges of caring for a child or for a parent or an adult, all of whom have a special need. You can plan respite care for a few hours at a time, maybe for a weekend, or even for several weeks or a month. It can take place in your home by bringing staff into your home to help out. It can take place temporarily in another setting, such as a daycare center, whether it's an adult or a child daycare center, a long-term care facility, other places in the community. Now, a lot of things have changed with COVID, and we'll try to make sure we recognize that as we're talking about these different options. So things that have been available in the past may temporarily not be available right now. For many caregivers, there's a lot of guilt when it comes to bringing somebody into the house to help or to ask for help, even from the outside. But what we need to remember is respite care really means that you're just sharing the responsibility of caregiving. And basically, you're sharing tasks. So you're not giving up your role as a caregiver. You are still the caregiver, but you're asking someone else to take some of the tasks, take some of the load off of you so that, I'll probably say this again later, but so that you can continue to be the spouse or you can continue to be the adult child. It's allowing you to continue that relationship and letting someone else pick up some of those tasks that can become overwhelming. Respite care actually strengthens your ability as a caregiver and allows you to continue providing care for a longer period of time in the home. It can take place intermittently or it can take place on a regular basis. So some folks have, a standard 1 or 2 days a week, 4 hours in the afternoon, whatever it might be. This is standard on Mondays and Wednesdays. I get to plan my schedule. That's when I make my doctor's appointments. That's when I get my hair cut, whatever it might be. Other folks use respite care on a kind of an as-needed basis. There's a wedding coming up, and I need to go to that wedding. Again, things have changed. We're not going to too many weddings right now. But respite care can happen on a regular basis, or it can be intermittent. However, what we need to remember that it always needs planning. It's not something that's just going to happen and we decide tomorrow that we want somebody to come in and help. Usually doesn't happen that fast unless you have a really supportive network around you. So it does take planning in advance. It takes persistence, and it takes patience, and it takes preparation. Now, as I said, the definition of respite care has changed over the years. And what we're finding out now that folks who are asking for, quote, respite care are actually looking for more full-time help. So they may need full-time help because they're working outside the home, or even if they're teleworking, they need someone that's coming into the house and taking care of the spouse or taking care of the parent or the child. It also means that some folks are looking at respite care as 24/7 because physically they can't do it anymore. The needs of the patient, the needs of the client have become so intense that this family, this caregiver, cannot provide all of those service continually. Or because they're maybe the sandwich generation. They're taking care of mom who has dementia, but they also have young children. Or there's other family members that they're taking care of also. So what used to be respite care as just a break for the family caregiver has really evolved into having full-time care or much more longer care for greater needs. Now, if your loved one is still living independently, there are some signs that we need to look for that indicate that they probably need some additional help that's going to come into the home. So if you notice that they have their hygiene is kind of going downhill, their nails are untrimmed, they have body odor, poor oral hygiene, their clothing is soiled, personal care for them might be becoming more of a challenge. So they may be having difficulty getting in and out of the tub. And they may be having difficulty using the washing machine, especially if they live on one level and the washing machine is on a different level. It might be becoming more difficult for them. They might have a fear of falling, whether it's going down the steps to get to the washer. They might have a fear of falling, getting in and out of the shower. If the clothes are soiled, maybe their eyesight isn't as good as it was, and they're not even seeing that there's stains on their clothing. If they have osteoporosis or arthritis, visual problems, memory loss, all of those things can present a challenge to performing the usual household tasks. So if your family member was usually a good housekeeper and you start seeing signs of an unkept house, that may be a sign that the help is needed. Strokes and arthritis and dementias may make it difficult for them to prepare meals. So if you notice that they're losing weight, when you go to visit and you notice that there's spoiled food in the refrigerator or scorched pans, or maybe you notice that food that you brought last week hasn't even been opened yet. Again, these are signs that they might be having difficulty. They're not always signs of dementia. So, but there may be signs that they're having difficulty through either cognitive difficulty or something physical that's going on that's making it very difficult for them to perform these activities of daily living. Check to see if your loved one seems unsteady on their feet. Are you noticing bruising or other injuries? Are they avoiding exercise, again, because they have that fear of falling? They can even be avoiding going out because of a fear of falling. Again, a lot of folks are not going out because of the COVID situation. But if they were going out before and suddenly you're starting to see signs of them being unsteady or you're seeing signs of bruising, that's an issue that we need to take care of. Checking to make sure that they understand the directions on their medications. Can they read the fine print? You all have probably seen your own medication bottles or the medication bottles of the person you're taking care of or your loved one. And that print is very small. So are they able to read the fine print? Are they able to open the bottles? Some of these safety caps are very difficult to open. Are their medications left when the bottle should be empty, which means they're forgetting to take them or they're unable to open the bottle? We need to be careful of our older folks too, because con artists, the spammers are out there and they're targeting the seniors who live alone. So when you're visiting, look for increased sweepstakes and charity mailings in the mail. Check out their phone bill. Are there some unexplained telephone charges? Are there lots of magazines coming in the house now? So try to be aware if your loved one is being taken advantage of. Folks who have dementia in particular find it difficult to sort through the junk mail and ads that come with the mail. So their bills may be actually getting lost in that pile of mail that comes. So, you want to be able to check to see if their bills are being paid on time. If you're seeing some of these things happening, then it's time to reevaluate the situation and look to see what kind of help is needed. It could be if mom is just having some pain from arthritis, if there's some vision issues that make it difficult for her to do the laundry. Some of those more simple things, and they're willing to let someone come in and help. It can be as simple as that. If there's some dementia issues that are going on, we need to reevaluate and see if it's safe for them to be in that house. Can they stay in the house if there's someone coming in on a regular basis? So it's really a matter of constantly reevaluating the situation. Now, for yourself, you need to consider caregiving when it starts having an effect on you, or you need to consider having someone come in, because in addition to the caregiving duties that you are performing, for those of you that are already involved in this, caregivers tend to absorb their loved ones' emotions on top of their own, which leads you to a physical and an emotional and a spiritual exhaustion. I don't know if you're aware of it or not, but 50% of caregivers suffer significant clinical depression compared to non-caregivers. Given this time of COVID and what all of us are dealing with, we need to be really aware of that and really aware of our emotions. Caregivers have more physical health problems because they have a poor immune system. So wounds heal more slowly. You tend to experience more cold and viruses. You tend to suffer through more physical pain. And part of that is because of the manual tasks that you are doing. So again, we need to constantly reevaluate what we're able to do. If helping mom out of the chair several times a day is putting a strain on your back, then we need to figure out a solution. Talking to a physical therapist to help you of how you can take care of yourself while you're helping mom. Or again, we need to bring someone else into the house to help us. You want to make sure that you get help for yourself if you experience any harmful behaviors towards yourself or towards the care recipient. If you are easily angered or annoyed by the care recipient. If you feel like you are crying frequently, or you feel like you can never do anything good enough, if you've lost interest in other people and in activities that you formerly enjoyed doing, if you're experiencing panic attacks or continual anxiety or chronic headaches, and definitely if you ever have thoughts of suicide or death, make sure you reach out for help. We all need help and we all need support at some time in our life. In order to be an effective caregiver, you need to take care of yourself first, because when something happens to you, who's going to be there to care for your loved one? So again, constantly reevaluate your limits, know what you can do and what you cannot do as far as taking care of your loved one. And also remember, it's okay to look at what you will do and what you really do not like to do. And we'll talk about that a little bit more in a few minutes. But again, keep in mind if you've ridden on an airplane before, and you know when they're giving you the safety instructions first, and they're showing the oxygen mask, and they're always telling you, put it on yourself first, and then you help those around you. You have to take the oxygen first. You can't care for someone else if you are sick or you are hurting or you are so depressed that you can't provide that care. So determining the needs, it's again important for us. None of us are superheroes. Caregivers tend to think of themselves as being able to do things at all times. or they feel like they should be able to do all things at all times. But everyone needs a helping hand and an occasional break. And, believe it or not, even though your loved one may resist having someone come into the house that's not a family member, that's not you, oftentimes they really do wind up enjoying the change in routine, and they enjoy interacting with someone different, even though they said no initially. They enjoy having someone that they can tell that same story to that you've heard a dozen times. And this new person may not roll their eyes at them when they hear the story. So even though there can be some resistance in the beginning, oftentimes they really do enjoy having that new person in the house. If you're caring for a child with special needs, having someone new coming in the house can provide some new experiences and help them develop some new skills and develop some independence and the ability to make new friends. If you are developing or if you are seeing some resistance from the person that you're caring for about having a stranger come into the house, we may need to take things gradually unless it's a crisis situation. Otherwise, we take things gradually. We introduce the idea and we listen to them. We listen to what their fears are. We let them talk about it. They have fears and they have reasons behind that resistance. But then you need to also discuss what your needs are. You need to be honest and say, I need a break, or I can't physically do this task with you. Then you present options. So what are the options out there? We can have someone come into the home, or you're going to need to go into an assisted living facilities because I can't physically do this anymore. So you have those options prepared and you let them know, here's the options out there. What can we work towards so that you're getting the care that you need, and I am able to continue helping you and supporting you and being your primary caregiver for as long as possible. If you have someone who has a dementia, you can always use what we call a fiblet or a loving lie, and let them know that the person's coming in is maybe your friend, or it's a volunteer from the church, and they're there to help you. They're not there to help your loved one because they don't realize they need help, but that person has come in to help you. Generally, over time, as your loved one gets used to this person coming into the house, they'll become more accustomed to it, and it'll be much easier for you to get out. For some of our older adults who, maybe have had to pinch pennies along their life, you may need to tell them that this is a free service and that their tax is paid for, even though you know that's not true. Now, again, if they're perfectly cognitively aware, you're not going to use those kind of little fiblets or white lies. But you need to be honest with them and, understand that this is what has to happen so that you can get the best care possible. So I know some of you are on the phone and you can't see this form. It's called the Identifying the Care You Need form. I'm going to send this form out as well as the PowerPoint and some other forms that I'm going to show you on this PowerPoint. I'm going to send them out to all the attendees next week. So you will have these. But identifying the care you need, if you happen to have a piece of paper and a pencil right now, you can just kind of jot things down. So as you start thinking about, I think I need help, I'm getting really tired, I can't do this anymore, but you want to identify specifically what kind of help that you need. So the first question is, I need respite care too. So this is, what would you use respite care for? So, you think about the first one or two things that come in your mind. Maybe it's so that you can go to a support group meeting. Maybe it's so that you can go to the movies, because some of the movie theaters have opened back up again. Maybe it's just so you can take a shower without having to rush out, or that you can take a nap, or maybe you need respite care because you need to get back to work. So that's the first thing, is thinking about yourself. Why is it that you need respite care? What do you need for yourself that you need to have some help come in? And then we want to look for what specific dates and times do you want someone to come in? Maybe that's not important to you. Maybe you just want someone to come in once or twice a week, and you'll schedule your appointments around that. But maybe there are things that you have specifically decided you want to do. And so these are the times and the days that you're going to need this help. Then let's think about what kind of task that you need this home care worker, this respite care worker, to do for you. Do you need help with your loved one's laundry? Do you need help preparing meals for your loved one? Do you need someone to take your loved one to doctor's appointments or to the grocery store or to other errands? So again, let's be specific on what it needs. Sometimes the calls we get at our respite care program are things that caregivers are having a difficult time doing. And one of the major issues is bathing. And, if any of you have been to any of our other workshops, particularly on dementia, you know that bathing can become a big issue. So sometimes workers or family members are just looking for someone that can come in a couple times a week and take over that bathing issue so they don't have to deal with that anymore. Then I want you to think about the people that are currently in your life and jot down just the first two names of people who could possibly help you. So, who are two people that might be able to take over some of these tasks that you talked about? It could be a family member, it could be a neighbor or a friend. Maybe your church has a ministry where they go out into the homes and help people. It could be just someone that can come in and sit with your loved one. Again, while you take that bubble bath, while you take that shower, while you get to have a nap. So think about who's already in your circle of support who may be able to come in and give you that kind of help. Then I want you to, when you get this form or on your piece of paper that you have now, I want you to write down 3 things that you can do for yourself over the next month. That's 4 weeks. I think you can think of 3 things that you can do for yourself. Maybe it's finding 10 minutes a day to read a new book. Maybe it is taking time to have a little longer than usual shower. Maybe it's sitting down in the evening with a cup of tea while your loved one is listening to some music. So think about 3 things that you can do for yourself over the next month. And then when you get this form or when you finish the paper that you're writing on now, I want you to hang that someplace that you're going to see it, that it's going to be prominent, maybe on your refrigerator, on your bathroom mirror, someplace that you're going to see this form every day, so that respite care is going to be continually on your mind until you decide what it is you need to do. So, out of home versus in-home respite care. So this is where things have changed a little bit over the time with COVID. Out-of-home respite care in the past for adults has usually been days, maybe 1 day a week, 2 days a week, or even 5 days a week at an adult medical daycare center. There's a couple of them in Anne Arundel County. We've lost a few over the years, but right now I believe we have 3 in Anne Arundel County. So adult medical daycare centers, most of them are not open right now due to COVID. Assisted living facilities. At times, if you're looking for a period of 2 weeks or 3 weeks that you need some respite care with your loved one out of the home, a lot of the assisted living facilities will provide that care. That's where it takes planning, though, because there has to be physicals, there has to be evaluations. It's not something that you can call and say, I'd like to place my dad in your facility for a couple of weeks starting next Monday. It's not going to happen that fast. You do need to go through an evaluation process. But if you need to have some sort of surgery or some sort of medical care, or you need to go out of state for a period of time for another family emergency, certainly we can look at the assisted living facilities. Many of them have designated beds that they keep for those reasons. Other folks will be, if they have the room available, then they'll work with you on that. The department, it's on our website, there is a list of all the assisted living facilities in Anne Arundel County available to you. So you can certainly look at the list, check those that are maybe close by to you, give them a call and see if they have respite care available. For children, now I'm not as familiar with the children's programs as I am the adults, but for children, there's family care and foster care homes. There's also daycare centers when they're open. There's residential facilities. A lot of children programs have parent co-ops. So parents work together, taking turns taking care of other children. And during the summer, there have been camps. Again, a lot of these activities are not available during the COVID period, but hopefully, in the next year, they'll be open again. In-home care, we're looking at a couple different ways we can do that. We can start with what we call informal care. So even though you may not feel as a family caregiver that you're informal, we consider family caregivers as informal care. You're not getting paid for what you're doing. Informal care is families, again, friends and neighbors, and volunteers. So when you're looking to put together some support, you may want to start with your family and you let the extended family know, I really need some help. And you need to be specific of what help that you need and see who can come in and help you. Keeping in mind that no one is going to do things exactly as you do it, and that's okay. We're not striving for perfection here. We're striving for the best care that we can provide. Friends and neighbors may be willing to come and help. And maybe they're not comfortable doing some of the tasks, so they may not be the folks that you ask to help with bathing issues, but they're the folks that you can ask to come over and sit with dad so that you can get out for a little bit. They're the folks that are going to be more willing to help you with certain tasks, some of the minor tasks that just keeping dad company and keeping him socialized. Volunteers, again, a lot of churches have social ministries that they have folks that they're trained to come in and again, mainly do sitting and kind of, I don't want to say babysitting because we're not talking about babies here, but these folks are just there to sit with the folks to socialize them. And socializing with your loved one is really a big deal. They tend to get very isolated. And during this time of COVID, we've been really concerned about our caregivers and the care recipients because many of them are not getting out very much anymore, and they can tend to become very isolated. It's not good for you as a caregiver, and it's really not good for the care recipient either. So that's our informal care, but then we also have professional care. And that professional care, we're talking about home care agencies or independent contractors. So let's talk a little bit more about some of these out-of-home and in-home care services. So when the adult medical daycare centers open again, those that are good candidates for that are our older adults who can still benefit from friendships and who can still benefit from functional assistance and who are still physically and or who might still be physically challenged or they might be cognitively challenged. So the services of the adult medical daycare centers include things like arts and crafts. They have musical entertainment. They do some mental stimulation. They do gentle exercises, and they have discussion groups. They do some local outings, and they always include some nutritious meals and snacks. When you get to the point that this is something you're looking at, when these centers are open again and you're able to visit, you want to ask certain questions. So you want to ask who owns or sponsors the agency. There's the two agencies that I know of in Anne Arundel County are for-profit businesses, and there's another nonprofit adult medical daycare center. So you want to ask that. You want to ask how long has it been operating? You want to make sure that it's licensed. You may want to check to see if transportation is available, if that's something that you need. You want to ask which conditions are do they accept? So, do they accept someone with memory loss, with limited mobility? Do they accept folks who have incontinence issues? What are the staff's credentials and what's the ratio of the staff to participants? You may want to ask what activities are offered and make sure that the meals and the snacks are included with the fees. You definitely want to find out the cost. You want to find out if there's a sliding fee scale and if there's financial assistance available. So again, the assisted living facilities we talked about, they sometimes offer short-term live-in, and same kind of questions you want to ask them. So, you want to make sure they're licensed. The Department of Aging and Disabilities oversees the small assisted livings in Anne Arundel County, which there are 90 plus of the small assisted living, which means 16 beds and under. They are licensed and they have nurse oversight, but there's always folks that are popping up and developing what they're calling assisted living. So you want to make sure that where you're putting your loved one is a licensed facility. With the assisted living facilities also, you want to be clear on what that price is for that period of time that you're going to be having your loved one there. You want to look at that staff to a resident ratio and find out what level of training that their staff have had. When we're looking at informal in-home care, keep in mind that even with family, when you're dealing with your family, that effective communication is really critical. You need to keep in mind family dynamics. So if you're looking for someone to come in and take care of dad for the weekend so that you can get away, but this family member is going to be extremely uncomfortable doing some of the physical, personal tasks that are required, that's probably not going to work. So we need to be looking at the family dynamics. We need to be looking at what individuals are capable of doing and how they can actually help. Make sure that you're keeping your family members updated on your loved one's needs and conditions. Those family members that are not sharing the day-to-day caregiving, that are not there to see the day-to-day interactions and the day-to-day behaviors of your loved one, may not fully appreciate what the situation is and how tough this caregiving is. Make sure that when you're talking with your family member that you stay calm. Our family dynamics from when we were children tend to occur just the same as when we're adults. So we need to keep calm and not let ourselves get pulled into those childhood rivalries that might have been there. Again, you need to state clearly what help you need. You really need to be specific with what the needs are. Ask the family to complete a schedule of who can help when and what is it that they can do. Have them sign up for specific tasks if that's possible. Again, asking folks to help according to his or her talents and his or her abilities. The same thing with the friends and the neighbors. Again, being specific about what kind of help that you need so that you can get a break, but realizing that they're not going to have the same buy-in as a family member might have. But again, be specific. Give them small tasks to do. Maybe just short visits to start with. Ask them maybe if they can find some music and come over and listen to some music, or if there's a movie that they could play and watch with your loved one. Again, volunteers, some churches have ministries. When schools are back in person, a lot of times they have community service hour requirements for the high school students. And so sometimes it's a really good match for high school students to come and sit with some of our older folks, because they can actually they can actually get some history lesson while they're sitting there talking to your loved one. So keep in mind that, our volunteers, our families, and our friends and our neighbors, may not be able to do that heavy duty caregiving services that we're looking for, but they can sit with your loved one. They can take them for a walk, maybe take them out to get some ice cream, something like that. Our professional and home care agencies, if they have a registered nurse on board, or if they have LPNs on board, or they provide skilled services such as medication management and wound care, if they have therapists on board, such as speech therapist or occupational therapist or physical therapist, they must be licensed by the state. Home health aides, many home care agencies have what they call home health aides, where they use certified nursing assistants who can help with some of the activities of daily living, such as bathing and dressing, cooking, and light housekeeping. Home care companions provide what we call supervision and cueing, and they provide some of that social interaction. And that social interaction, again, is extremely important. Our home care companions may be able to provide limited services such as light housekeeping and preparing meals. So there's lots of choices out there. Again, because of COVID, some of these choices have been narrowed down. So some of our, again, the daycares may not be open now. The assisted living facilities might have a little bit tighter regulation of who they're letting into the facilities right now. But again, certainly worth a phone call. Most of the home care agencies in the county they were a little frozen in time at the beginning of COVID, but most of them are, again, sending workers into the home as long as there's no one in the home that has COVID symptoms. The Respite Care Referral Program, which we'll talk about in a few minutes, which is a registry of independent contractors. We also have workers that are going out into the homes right now. So in-home care is pretty much available at this time, as long as you're comfortable. There was a time where we weren't even getting calls for help because people were not comfortable letting someone come into the home. But I think things as far as in-home care are starting to open up again. So how do we find this care? Well, first of all, word of mouth. You have a neighbor who used this lovely lady to help with her mom, and she's recommended her. And so you're now going to use this lady to help with your mom. Area agencies on aging. So in Anne Arundel County, that's the Department of Aging and Disabilities. We are certainly a resource in helping you find that care. And one of the programs that I oversee, as I was talking earlier, is our Respite Care Referral Program. And what this program does is we screen and we train in-home care workers. We actually just finished a 3-day virtual training today for, I think we had 5 or 6 new workers join the registry by the end of today. So how our program works is we do background investigation when folks do their application with us. It's the first thing we do. And if that individual's background check comes back absolutely clean, then we will take them further along in the process. And part of that is the training that they do with us. As I said, we've done 3 days of training this week with these new staff. Every year, these workers are required to redo their background check, and we require additional education for them each year. So again, those are independent contractors. They're not employees of the department, and it's through the Area Agency on Aging. You can also look online. There's referrals sites online. The one that pops in my head is care.com, but I know there's other ones out there that you can look at. If you're caring for a child, certainly the schools may have a referral system for people to help you in your home. Ask your loved one's physician or pediatrician if they know of anyone who does home care. And then the last one, where I have online newspaper and posted ads, and you see a caution sign there. Be very cautious when you see an ad. Anyone can place an ad in the paper. Anyone can put a card up at the grocery store. with their name and number telling you that they do home care. So when dealing with caregivers that you don't know anything about, be sure to follow the steps that we're going to talk about in the next few minutes. So you want to make sure that you do a little bit of investigating to make sure that you're comfortable with this individual coming into your home. If you're hiring a home care agency, so let me back up just for a second. So we can bring an independent contractor in, we can work with a home care agency. There's pros and cons to both situations. Home care agencies are generally going to be more expensive because they have overhead. They have buildings with offices in them. They have staff that they're paying. So they have overhead. They're going to be more expensive. I believe right now the starting price is maybe about $22 or $23 an hour. And then it goes up with certain things that are needed, things that are in addition to what the basic needs are. For an independent contractor, it's going to be cheaper. So as I was just talking about the respite care referral program, our generally on average, our workers charge between $14 and $19 an hour. They can do that because they're independent. They don't have overhead to worry about. One of the pros of working with an independent contractor is you're actually picking who's coming into your home. You get to decide the person that's going to be coming in, taking care of your loved one. A home care agency is going to assign someone to come in. But one of the pros for the home care agency is if that person doesn't show up, they should be able to send out a replacement. With an independent contractor, you have to have a backup plan. If your home care worker becomes sick and can't come to work, you need to have a backup plan. So again, there's pros and cons. When you're working with a home care agency, it's a little easier on you because once you've done your background work, which we're going to talk about, once you've done that, you sign a contract with the agency and they take care of everything else. If you're working with an independent contractor, you're going to have to do the pre-screening call, which we'll talk about. You're going to have to do the interviewing, and you'll actually hire and, if necessary, fire the worker. But again, some people prefer that because they like picking who's coming in their home. Pros and cons, it's an independent individual decision. And when folks call us up looking for respite care, we work through that with them and what's going to work best for them. So if you're hiring a home care worker from an agency, when dealing with that agency, you want to ask questions like, how long have they been in operation? Lots of home care agencies in Anne Arundel County, many of them are franchises. So they're backed up by a large corporation. And many of them have been in the county for a very long time or have been in the state and moved into the county. But there's also a lot of small independent home care agencies who you need to kind of keep check on because one day they're here and the next day they're not. Ask to see their licenses. Ask what kind of care do they provide? Do they have nursing oversight? Do they provide therapeutic care if that's something they need? Ask them how they screen their workers. Are they doing a local screening or are they doing a national screening? How far back do they look? And what do they consider acceptable on the background check? Find out what the training level of their care providers is. Ask them if they provide training to their workers and if that training is mandatory. Find out how their workers are supervised, who is supervising and how does that happen. Ask them what their emergency procedures are. Is there someone available 24 hours a day to handle a crisis? What happens if a worker doesn't show up or leaves in the middle of a shift? Make sure that you know all the costs that are involved for all the services and have a copy of their fee in writing before you sign any contract. Check what they charge extra for, what kind of services are extra. Um, if you're going to need home care during a holiday, find out what that involves. So is that time and a half? Is it double time? So know all of that up front. And then you may want to check with the Better Business Bureau to see if there have been any serious complaints against that home care agency. Now, if you're hiring an independent contractor, your responsibilities include giving clear directions. Don't make any assumptions that they know exactly what you want them to do, because every client they have is going to be different. So you want to make sure you get clear directions, that you're consistent, that you're business-like. You want to check with your homeowner's policy or your renter's policy if you're renting, to make sure that that worker is going to be covered if they fall or hurt themselves within your home. And you want to complete a written agreement form or written contract with this worker before they actually start working. So one of the other things that I'm going to send you when I send information out to you next week is some sample interview questions that you can ask. So we suggest that you do what we call pre-screening phone call. So you're going to call the worker up and you're going to ask them questions, basic questions such as, are you available for whatever dates and times that you're looking at? And then if your loved one has dementia or has Parkinson's disease or any other, maybe diabetes, anything that's specific, you ask the worker if they've ever had a client that they've had to care for before who's had those symptoms or had that disorder or disease, just to see how comfortable they are with taking care of your loved one. It's also a time that the worker can ask you questions. So if the worker is allergic to dogs, they may ask you if there's a dog in the house or a cat in the house or anything like that. You want to talk about on the pre-screening phone call, just in broad details, what you're looking for. So you're looking for someone that can come in 3 times a week for 4 hours. And the things that you want them to do is fix lunch for your mom on the days that they're there, and do some socializing activities with her. And maybe on those days, if they can strip her bed and do a load of her laundry, things like that. You want to tell them a little bit ahead of time what you're looking for. If you're looking for them to take your mom or dad or your spouse to a doctor's appointment or to get a haircut or, just for a ride once a week to get them out of the house, let them know that ahead of time so you can all discuss what those arrangements were going to be like. Then you're going to have them out for an interview. And again, I'll send you some interview questions next week, but you basically want to ask them, first of all, you always want to ask to see their ID. So you always want to ask for that driver's license so we can make sure that that person is who they said they were on the phone call. You want to ask about their education and their training. So have they taken any classes? If your loved one has dementia, have they taken any classes that have dealt with dementia or diabetes or, again, any specific topic that you've had of? Ask questions, again, specific to the job. Do they know how to get someone who's resistant to bathing into the shower or to get them cleaned up? So ask questions that are specific to the task that you want them to do. If your in-home caregiver is going to be driving your loved one places, it's okay to ask them for a copy of their driver's license, or not their driver's license, I'm sorry, of their driving record. And that is something that they can get from the Department of Motor Vehicles. So it's fine for you to ask them to see a copy of their driving record. And you may ask for a proof of their car insurance also. Always let the caregiver meet the person that they're going to take care of. It's really important to make sure that there is nothing there that makes anyone uncomfortable, that your loved one seems comfortable with this person, that this person is able to have a conversation and interact with your loved one. So never hire somebody until they've had a chance to meet the person that you're caring for. And always ask for references. So I know with our respite workers, we tell them to always carry a copy of references with them on an interview so that they can hand it to you at the end of the interview. But you always want to go back and double check those references. And once again, when I send you interview questions, we'll send you some sample questions that you can ask on ask for a reference. These are not questions that you're obligated to use, but for some folks who are new to this hiring process, sometimes they don't know where to start. So these questions are just to start. You can feel free to add to them, to change them, to do whatever you want. Before you hire an independent contractor, unless they came from the Respite Care Referral Program, or you know we've already done that background investigation, if it's not someone who has come from our program, you want to make sure that you do a background investigation. But I want to tell you, be careful when you're searching online, because there's an awful lot of times where people have the same name. And a lot of times you can get some misinformation. You can get some very bad information about someone that you think you interviewed, and actually it's a different person. So just be careful when you do this investigating online. Unfortunately, you know, we can Google so much, but not everything that we find is actually factual. But you do want to make sure that you do these references and you try to do a background investigation. So I know the big question is who pays for all of this. So, you know, respite, as we talked earlier, can be free if you have family or friends, or, you know, a church group or a volunteer organization, or you're involved in a co-op, you know, then respite care can be free. But normally it's not. A lot of people think that Medicare pays for respite care. It does not. Medicare will pay for medically necessary skilled care only. So we're talking nurses, we're talking physical therapists, occupational speech therapists, but not home care workers who are there to provide personal care or homemaking services or chore services or custodial care. Medicare does not pay for that. Medicare pays for skilled care in home and out of home, usually in a nursing home situation. But again, only for a limited amount of time. But it doesn't pay for respite care. And we get a lot of phone calls from folks whose loved one is coming home from the hospital or is coming home from a facility, and who have been told that maybe a nurse is going to come in. Well, they think they're getting respite care. Unfortunately, what that generally means is the nurse might come in twice a week to take blood or to do some wound care, and is there to perform a certain task and then is on their way again. So for adult daycare, for out-of-home adult daycare, normally it's private pay. If you have long-term care insurance, or if your loved one has long-term care insurance, oftentimes that will pay for adult medical daycare. What I want to say about long-term care insurance is every policy is different. And so you really have to read through it. You really have to understand what they're going to pay for, whether it's in-home or out-of-home care, because every single policy is different. For adult daycare, sometimes there's income eligibility programs, so they might have sliding scale fees. Some of the homes have grants. Some of the adult daycare centers have grants. The VA will often, if your loved one is eligible, the VA will pay for adult daycare. And also, if your loved one is Medicaid eligible, if they are on a Medicaid waiver program, oftentimes they will support adult daycare services also. Our in-home aides are generally private pay again. Again, some long-term care insurance policies will do in-home care. You need to check how many hours or how many days that's available. You also need to check, because some long-term care insurances require that you use an agency versus using an independent contractor. Some of them require that the individual, the caregiver, is a certified nursing assistant and not just the companion caregiver. So again, it's important to look at those long-term care insurance policies. The Medicaid waiver program, again, is an income eligibility program. If your loved one is eligible for that, they often will do some in-home respite care. And it can vary from 4 hours a week to almost full-time care, depending on what the medical needs are of your loved ones also. Veterans benefits often pay or help pay for in-home care. SSI for those adults with disabilities. The Developmental Disabilities Administration, if they have funding available, can help pay for in-home care. And there's various grants. So oftentimes the Alzheimer's Association might have grants to help with folks who have a dementia. At the Department of Aging and Disabilities, we have the National Family Caregiver Support Program, which, when funding is available, can provide a grant. In the past few years, what we've done is a $500 grant to family caregivers so that they can use it towards respite care. The grant is made out, the check is made out to the family caregiver so that you can decide who you're going to pay to do that respite care. So you can hire a home care agency with that money. You can use it to hire a respite care worker, an independent contractor. You can use it towards an adult daycare when they're open. So again, when the funding is available, there are grants available. We gave the last of our grant money out for the past fiscal year. I think it was about mid-September. Even though the grant is a federal grant that starts on October 1st, normally we don't see our funding come through until the first of the year. So you can always check back with us in, I'd say mid-January to find out if we have respite funds available yet. And then usually we just tell you to keep giving us a call until we know the funding is there. So I want you to keep in mind a little bit about what your rights are. And to recognize that it's okay for you to have whatever feelings that you have. It's okay to be angry. It's okay to be frustrated. It's okay to take time out for yourself and to ask for help. Trust your gut feelings, recognize your limits. It's okay to make mistakes. We are not perfect. We cannot be perfect. We cannot put that kind of stress either on ourselves or in anyone else who's coming along to help us. It's okay to cry. It's okay to be sad. It's okay to grieve. It's also okay to laugh and to hope. And we need to learn to recognize and accept our feelings. Our feelings are what they are. We don't have control of how we feel. What we do have control is of how we react to those feelings and how we react to the problems. When you're angry or frustrated, it's important to know what techniques work for you to help you calm down. Is it deep breathing? Is it meditation? Is it venting to a friend? Is it just going outside and maybe screaming at the top of your lungs for 30 seconds? But learning to think, learn to know how to control those feelings so that you're not taking those feelings out on the person that you're caring for. But keeping in mind that our feelings are just our feelings and they're okay. It's what we do with them that's important. So just some final thoughts for those of you that are on the phone and you can't see our little cartoon, our little comic strip that we have up here. We have, it's the mother who is saying, I've never been a caregiver before. My first husband died suddenly. He was fine until then. And I love your dad with all my heart, but he wants me to be with him night and day. And frankly, I'm going a little crazy. And the stepdaughter says, well, Iris, I had no idea. And the mother says, well, I never said anything. Besides, I feel guilty just going out for a walk. What if something happens? But we've only been gone for 10 minutes. Well, it seems like an hour. I guess that's one good thing about all this. Time isn't flying by as fast as it used to. So I want you to keep in mind that you are more than a caregiver. And just like those that you're caring for, you have experienced a loss or multiple losses. Some of you may have lost your jobs. You've lost the ability to travel. You may still have a job, and now you're juggling that along with your caregiving duties and everything else that's come upon you because of COVID. It's really important to make time to play. I'm not talking about 40 hours a week. For those of you that are not looking for full-time care, sometimes it's just about going for a walk out in the fresh air for an hour or so, or having a bath with candles in the bathroom, or getting your hair done. Keep your expectations reasonable. And remember, again, no one is going to be able to live up to the expectations that you have for yourself. No one will be as good as you in the eyes of your loved one. Respite care always requires some fine-tuning. Anticipate and expect changes in workers, especially when you're dealing with a home care agency. You may have change in workers, so you have to be ready for that, and you have to make that okay with your loved one. Especially if there's a dementia involved, they can get very confused by other folks coming in the house. So you just need to reassure them that it's okay, that they're going to be safe, and that you're comfortable with the person who's coming in. Respite care provides or promotes and supports balance in your life. Just anticipating a break can be a lifesaver. Keep in mind that this caregiving journey cannot be done alone. Allowing others to help you does not diminish your role as a caregiver. Just like I said earlier, you are merely giving up tasks so that you can prolong a loving relationship with your loved one, and so that you can provide that care at home and keep them in a home situation as long as possible. But also keep in mind, if you get to the point where you cannot provide that in-home care anymore, either because their needs have greatly increased or because your physical or emotional balance cannot allow you to provide 24/7 care anymore. If your loved one goes into an assisted living facility or another long-term care facility, you are still the caregiver. You haven't lost that role. We need to allow ourselves to remember that caregiving doesn't just mean we have to be providing services. What caregiving means is that we're making sure that our loved one is getting the best care possible. And sometimes that best care possible isn't from us. Sometimes that best care possible has to be from some professionals. So keep in mind that it's not a failure if your loved one needs to go into a facility. That doesn't mean you failed. Actually, what it means is that you care enough to make sure that they're getting the best care that is out there and that you can no longer provide. So I hope that you feel a little more confident in asking for respite care. I hope that you realize that not only is it okay to ask for help, but it's necessary, and that you feel more confident in going through the process of getting help, whether it's in home or out of home. For those of you that can see the slide, please feel free to write down my email address and my phone number. If you have any questions, I'd be happy to answer you. I will be out of the office tomorrow. I'll be back on Monday, so that's why I'll get you this information next week. But I really appreciate that you called or that you attended tonight. For those of you that are on the phone, if you need to reach me, my phone number is 410-222-4339. So again, I thank you very much for being here tonight. And this will be recorded, so you'll be able to see this online if you want to go back and look for any more information. If you're not aware of it, on our department's website page, which is www.aacounty.org//aging, you can find other videos that we've done since March or April, or online for you to see and to view. I think most of you are on our mailing list. If you haven't been receiving mailings from us before, we've got your email now, so you'll be getting monthly emails from us with updates on programs that are happening both within the caregiver program, as well as things that are happening in the Department of Aging and Disabilities and in the community. And you'll also be receiving our quarterly newsletter. If you're not aware of it, there are family caregiver support groups that we are now offering virtually. We offer one on the, let me think here. Generally, it's the second Wednesday of the month. In November, it's actually the first Wednesday of the month, because the second Wednesday is a holiday. And we also offer one on the third Tuesday of the month. So when you get your email from me, you'll have the information about the support group in there. We also have a caregiver support group Facebook page, and that information will be in your newsletter too. So if you would like to join us on Facebook, of course, there's the department Facebook page, but we also have a group within the department that's just for family caregivers. So again, thank you very much for joining me tonight, and I hope to see you next week. We actually have another workshop that the Office of Emergency Management is going to be putting on for us. And then later on in November, we're going to have a workshop on planning for the holidays during the pandemic and while you're caregiving. So again, thank you very much, and I'll see you soon, I hope.